name is Nick. I'm a student physical therapist. Thanks for joining me today. Today I'd like to talk to you about the purpose and physiology behind pain. I think we have all experienced pain at some point in our lives. We all have our own unique definition and experience. However, most of us can agree this is an unpleasant experience. So why do we have to go through this? Why is pain necessary? Pain, when functioning normally, is a mechanism of protection for our body. Imagine when you slip down the stairs and twist your ankle. The pain functions to let us know that there's tissue damage and allows the brain to help us protect the area. This is why we often limp on the ankle for a few days afterwards. The brain is making sure the injured area is not put under any further or unnecessary stress so that it can heal. This is an example of acute pain and is a completely normal response. Acute pain is generally a result of tissue damage, and it serves the purpose of protecting the injured area. Once the tissue damage has resolved, the pain will go away. However, for many people, this may not happen. Chronic or persistent pain exists in more than 50 million Americans, and if this is you, it is important to know that you are not alone. Some key features of persistent pain are that the pain lasts longer than tissue healing time, there is no longer tissue damage, and unlike acute pain, there is no purpose of protection associated with the pain. So if there's no longer tissue damage or a purpose for this, why do we continue to have the pain? Well, to understand this, we need a better understanding of how the body and brain process pain. We have a central nervous system consisting of the brain and the spinal cord, as seen in the picture on the left, and a peripheral nervous system, which is all the other nerves and sensors, receptors throughout the body. These sensors can be in our skin, in our joints, in our muscles. They can sense heat, pressure, mechanical forces, chemicals, all different types of things. They help us to understand and maneuver in our environment. For example, when we move our arm, there are sensors in our muscles that are activated, and they send signals through the spinal cord to our brain, and this is how our brain knows where our limbs are in space. When you reach out to grab your coffee cup in the morning, the sensors in your fingers send this information to the brain, which allows the brain to determine that you are going to drink your hot coffee. It is important to understand that all of the incoming sensory information does not have any meaning until it reaches the brain, because the brain has the power to comprehend, called perception. When signals are sensed in the peripheral nervous system, you can imagine them almost just as shapes, lines, symbols, random things. On their own they have no meaning, but the brain can translate them into thoughts, feelings, or actions. Additionally, other factors can influence the extent or magnitude of the pain experience. Our emotions, our stress level, anxiety, and the context of a situation all contribute to how the brain creates a pain experience. For example, if we hurt our shoulder doing something enjoyable, such as playing golf, the brain may cause us to perceive less pain than if we are doing household chores when we hurt our shoulder. Our pain experience is created for us by our brain. The brain is the alarm system to our body. When the brain decides that the body needs protection, then it will provide us with a pain experience, which is the alarm. Now, in persistent pain, the brain has increased sensitivity to the possibility of danger. The brain has great intentions. It wants so desperately to protect us. It's necessary for us. Without pain, we would put ourselves in a lot of bad situations. However, in persistent pain, it is producing pain when you are not under threat. Imagine that you are mugged while walking to your car late at night after work. This is a traumatic experience, one that causes you physical and mental pain. Now, the next time that you walk out late at night to your car, you are hypervigilant. You see the shadow of a bush move with the wind, or you hear a leaf blow across the ground, and you are startled. You might even jump around and get ready to face your attacker. This is what happens to the brain in persistent pain. It is highly sensitized and may react to a stimulus by producing pain when there is, in fact, no threat to your body. This reaction is due to previous experiences and emotions that remind the brain of other times you were in danger. To finish off, pain education is lacking in the United States, even amongst healthcare practitioners. The first step in reducing the effects of persistent pain is a better knowledge of how pain works in the body and its purpose. I hope this short video has served to help your knowledge and understanding of the pain processes. Thank you.